Calagesic lotion contains Pramoxine, which is used to temporarily relieve itching and pain caused by minor skin irritation such as minor burns, cuts, scrapes, sunburn, eczema, insect bites, cold sores, or rashes from poison ivy, poison oak, or poison sumac. It can also be used to relieve itching and discomfort from hemorrhoids and certain other problems of the genital/anal area, such as anal fissures and itching around the vagina/rectum. Pramoxine belongs to a class of drugs known as local anesthetics, which works by numbing the skin to block the feelings of pain and itching. It may also contain other ingredients, including skin protectants such as calamine, zinc acetate, and zinc oxide. It is important to read the package instructions carefully before using this product, and do not use it for skin irritation in children younger than 2 years or for hemorrhoids or other genital/anal conditions in children younger than 12 years unless directed by a doctor. When using Calagesic lotion, it's important to follow the directions from your doctor or the product package. Make sure to clean and dry the affected area before applying the lotion. For skin irritation, you can apply it up to 3 to 4 times a day, and for hemorrhoids or other anal conditions, apply it after each bowel movement or up to 4 to 5 times a day. Avoid getting the product in your eyes, nose, ears, or mouth, and wash your hands immediately after use. If your condition worsens or doesn't improve after 7 days of treatment, make sure to consult your doctor. If you experience burning or stinging after applying Calagesic lotion, let your doctor or pharmacist know. Your doctor has determined that the benefits of using this product outweigh the potential side effects. Serious allergic reactions to this lotion are rare, but seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. Before using Calagesic lotion, it's important to let your doctor or pharmacist know if you are allergic to Pramoxine or any other ingredients in the product. This is because the lotion may contain inactive ingredients that could cause allergic reactions or other issues. You should also inform your doctor or pharmacist about your medical history, especially if you have deep, open, or puncture wounds, broken, damaged, or blistered skin, or if you have had animal bites or serious burns. If you are using Calagesic lotion for hemorrhoids and experience bleeding from the rectum, you should stop using it and consult your doctor right away. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication if it is clearly needed. It's important to discuss the risks and benefits with your doctor before using Calagesic lotion. It is not known whether this drug passes into breast milk, so make sure to consult your doctor before using it while breastfeeding. When using Calagesic lotion, it is important to be aware of potential drug interactions. These interactions could impact how the medication works or increase the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial to seek your doctor's approval before starting, stopping, or changing the dosage of any medicines while using Calagesic lotion. If this medicine is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to attend all your scheduled medical and laboratory appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to use Calagesic lotion at your usual time, use it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed dose and continue with your regular schedule. Do not use double the amount to make up for the missed dose. And always remember to follow the recommended dosage and schedule for the best results. When it comes to Calagesic lotion, it's important to store it at room temperature. Make sure to check the product package for specific instructions on how to store it, or ask your pharmacist for guidance. Always keep medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, Properly discard the product when it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for assistance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.